So the size of the breast has something to do with the volume of milk a woman produces. I mean, I don't know what I can talk about the two hormones. The hormone that helps to produce milk is prolactin. And then, of course, the oxytocin is the one that helps with the letdown. As long as there is suckling, then the message is sent to the brain that we need breast milk.
Hi mamas, I'm Oyemade Motunrayo, the founder of Wives and Mothers, and I'm your host for this podcast session. And Wives and Mothers is a platform whereby we educate, entertain, and inform mothers. And we also have an NGO whereby we help mothers, we provide them baby resource and also funds to help them live a better life. We help single mothers, we help widows across the world. With me here, we have Chioma. She is a renowned Nollywood artist and USAID Goodwill Nutrition Ambassador. Chioma has starred in over 100 films and is one of Nigeria's most respected actresses. She has received numerous awards for her performances and has used her platform to advocate for better nutritional practices and raise awareness about the importance of nutrition in overall health and well-being. Then we have Mr. Ebenezer Oluloto. He joined USAID Nigeria in December 2018. He has nearly 20 years of experience in community and public health nutrition programming. Prior to joining USAID, Ebenezer worked for various USAID implementing partners, including Ellen Keller International, Save the Children, Catholic Relief Services, and Global Alliance for Improved Nutrition. He earned a Master of Science in Nutrition and Dietetics from Federal University of Agriculture, Akpotha in 2011 and BSc in Biochemistry from Ahmadu Bello University, Zaria in 1999. Pleased to have you guys here.
Thank you very much.
All right, so guys, it's World Breastfeeding Week. So what have you guys been up to? Over to you.
We've been up to a lot of things. We all know that World Breastfeeding Week starts every 1st of August to the 7th of August every year. And for this year, we kicked off the World Breastfeeding Week by an event we had in Abuja where we gathered a number of, not just it was centered in Abuja, but across the nation, where we aimed to break a world record of having a number of women breastfeed at a particular time.
Wow, that's amazing.
Yes, so our target was 30,000 because the world
record imagine
was 19,000.
19,000. So our target was 30,000. But in fact, I was so excited. I didn't even know
it's really amazing.
So I mean, we got women. Our target was 30,000, like I said. But at the end of the day, at the end of the countdown, we have 31,250.
Wow, that's impressive.
Yeah.
Well done.
Meanwhile, we had 32,950 women or so there, but 31,250 women breastfed their babies between the ages of 0 to 6 months in a minute in Nigeria. Wow, so we didn't just break the world record. We set a new record.
You set a new record, exactly.
So yes, and then after that, we visited several hospitals, IDP camps, to encourage women and share the benefits of breastfeeding to them and how to nurture their children, not just from 0 to 6 months, but from 0 to they grow up. The children are our future, so we have to take care of them. Yeah, we've been everywhere. We've been everywhere. After we speak now, we're visiting another hospital, and this morning we went to Mercy Hospital. We know it's the oldest hospital in Nigeria and was converted to the Children's Hospital in 1961. So, I mean, that has to be the first place for us to visit.
I mean, you guys have been quite busy.
We've been quite busy.
Yeah, well done. So breastfeeding is such an amazing experience for everyone. So when you said over 31,000 women,
it came through to full experience.
I mean, trust me,
I was jumping
you
dancing.
You wouldn't have had it better ways.
And I was wishing that I was part of the women.
If you want to get pregnant again.
Yeah, well, not now.
So just to add that, so for the World Breastfeeding Week, the theme for this year is filling the gap. Closing the gaps.
Breastfeeding for all.
Yeah. So and all is about being able to provide the support that the woman needs wherever she is, whoever she is. in terms of whether it is education, whether it is access to food, whether it's access to counseling, whether it's access to like support, system,
support
that is required. So, different women, based on their settings, they have different challenges and things that constitute barriers to breastfeeding.
Yes.
So part of what we were focusing on within this 2024 is how do we remove those barriers? How do we ensure access, to quality service and support by all women to be able to breastfeed their children optimally.
I would like to also note that women should not be shamed, especially when they want to breastfeed in public. I realize that a lot of women are shamed when the woman decides to breastfeed in public. You just be like, why are you breastfeeding your child in public? I mean,
who would shame a woman who's breastfeeding?
There are people who do that. There are people who do that.
They're not all right.
They feel that she's exposing her boobs in public because she's trying to breastfeed.
Yeah.
Well, for me, if she doesn't have, if she's not properly dressed and doesn't have any sash or whatever to
some kind
cover
of
herself,
cover herself,
and she actually needs to breastfeed. She should
breastfeed.
I agree.
She should breastfeed.
Thank you.
That shouldn't be. That is not to say that the woman should just carry her breast and come out like that.
No. There are ways to curb it.
There's a reason she's being open. There's a reason. So she's not just bringing out her breast to I don't think anyone should shame a woman for breastfeeding.
There are people who do that.
I think women like that.
Even some women actually shame women who breastfeed in public. To be honest,
I think we are our problem.
I'm telling you,
we'll overcome.
Amen.
So those are part of some maybe norms in some settings that they feel like a woman should not breastfeed outside and all that. Women that are breastfeeding outside should even be celebrated.
Yeah.
I mean, I've seen maybe prime ministers of some countries who breastfeed, like legislation. One woman, I don't know whether it's in Brazil or Argentina, was a legislator. Take her child to the chamber. Was breastfeeding. So we should promote things like that and not make it look like there's something that is shameful or should be ashamed about.
Exactly.
You are, as I said, it's something you should enjoy.
Yes.
Enjoy doing. And breastfeeding is interesting because it can happen anywhere. It's not like you need to go prepare the food, hide somewhere and all that. And at the same time, for settings where maybe there are not a conducive environment for people to breastfeed, such service should be made available.
Exactly.
Whether maybe like a crèche or room
especially
or somewhere.
in the workplace.
In the workplace,
yes.
where women can easily just go. Because when you're also in a very relaxed atmosphere, it helps you to be able to breastfeed optimally.
Exactly. Yes. It gives you that comfort. Yeah. Thank you so much. Ms. Chioma, you have been a very strong advocate of nutrition. And what inspired you to take the role of Goodwill Nutrition Ambassador?
Well, first, I'm a mother, right? And I understand the importance of nurturing properly, giving the child the good head start they need in life, and then my desire to serve in that capacity. So when I was called and given the brief to being the Goodwill Nutrition Ambassador, it was so easy. Like, where have you guys been all my life? I want to use my platform, I want to use my voice, I want to use everything at my disposal to spread this good news, to spread the word, to share everything that we need to share through USAID to the people, to educate every woman on the importance of good nutrition and a healthy diet for themselves and their children.
All right. Thank you so much, Mr. Chioma.
Thank you.
And over to you, Mr. Ebenezer. Of course, breastfeeding is widely recognized as one of the most effective ways to ensure child health and survival. Ebenezer, can you discuss how USAID programs support and promote breastfeeding in Nigeria?
Thank you. So USAID, globally over the years has been the leading agency or champion for maternal and child nutrition. And even in Nigeria also, we have a lot of investment in terms of technical assistance or funding for programs, like programs that drive behavior change to support nutrition, gender programming, integrated maternal and child and health nutrition programs. And basically, what we try to do is to put the child and the mother in the focus. I mentioned earlier that our focus, our strategy, which align with that of the government of Nigeria, is looking at the 1,000 days as a priority for us, times of interventions. And we drive part of our support is to ensure that that woman has, during antenatal care services or during routine immunizations, have access to quality counseling. So we do training for health workers. We support the government to train health workers, provide job aids, for them. USAID has been, they're supporting in terms of adaptations of tools or job aids. We even do some transitions to local languages to be able to make it accessible, to both the community health workers, community resource persons, as well as even the mothers. So we also support the policy, areas of side of things, where we advocate to the government stakeholders to provide a living environment, for breastfeeding, like we've been advocating for 6 months maternity leave, for example. Some states are starting, like Lagos, a few other states, but we want something that is going to be cross-cutting across the country. So part of the thing we are looking at in this year, World Breastfeeding Week, is, we're talking about filling the gap.
Yes.
Yeah. So, and part of what
closing the gap.
Sorry.
And breastfeeding support for
breastfeeding
all.
support for all is to ensure that mothers everywhere have access to this. So whether it's in our humanitarian assistance response programming or to our development programming, we want to ensure that all that is required for this mother that we are supporting, the targeted spaces where we are supporting, have those access. And then we have something that is also more sustainable, where the community, the household, whether it's the male, religious, they're all the people that are influentials. They have the right message and the right attitude to ensure there's support, for mothers to breastfeed their children, so that we can have happy mothers and at the same time
happy child.
And of course,
Healthy
we have our ambassador here, to help us amplify those messages.
Yeah.
So I'd like to also ask, does it affect the produce of the breast based on the woman's breast size, Mr. Ebenezer?
I like the way you're putting Mr. Ebenezer on the spot. He's like, how am I the person to answer this thing? Do I have breasts?
It's a very interesting question. I've had that, many times when we have, engagement with women and discussing breastfeeding. So the size of the breast has something to do with the volume of milk a woman produces. Yeah. So what's affects breast production? I don't know what I can talk about the two hormones. The hormone that helps to produce milk is prolactin, and then of course the oxytocin is the one that helps with the letdown. As long as there is suckling, then the message is sent to the brain that we need breast milk. As long as the child is sucking, the breast milk is going to be flowing. There are situations and time when, because of maybe circumstances that are around the women, she might not be in a very good frame of mind. And she mentioned something earlier about, early initiation of breastfeeding, for example. If a woman, when you give birth, they are cleaning you up, you go bathe, wear perfumes, you're looking like you're ready for another child. And then the child is taken elsewhere, maybe after 24 hours or sometime, then you bring the child back to come and suckle. The child is not going to suckle. One, the part of the body you are talking about, the child is supposed to know the smell of the mother. You're supposed to be taken to the breast immediately, like within that 1 hour. If our FMOH at some point we're talking about within 30 minutes, but within 1 hour is fine. Around that time, the breast is ready to come, and then the child is not ready to take it. So by the time you do all that, one, the breast is not going to come when you are ready, because at that time, the child also, when you come, he might not be encouraged to suckle, because as at the time he require it, it was not given. And then some of the the smell of perfume or that can also discourage the child, that kind of thing. You see maybe some soap or this and that child. So it's something that we need to investigate. Why, for example, maybe the child is not suckling. It might be the reason why the breast is not, because the more breast milk is removed, the more the breast milk is produced. Right? And so it has something to do with the size of the breast.
Like if I may add something, right? The size, I think what most women do not understand is when it comes to breast size, it's the travel time of the breast milk that they actually, the bigger the breast, the longer the travel time it is to get to the baby. Because for me, my breasts were not very big, so it was very quick to expel and easy for my baby to get the breast milk, and also very quick to finish. So I found out that sometimes I was always eating, it was bigger, and I had to take fluids a lot, so that the breast milk would be easy to come through. So I think some people who are bigger, the travel time is longer, but the breast milk is there. So it just depends on how prepared the mother is, how psychologically ready she is to feed her baby.
Thank you very much. Thank you. Sorry.
Thanks. So perhaps also you talk about attachment. Sometimes when a baby is not well attached,
can also affect the flow of breast milk. If you
put the baby's mouth into the nipple, the baby will be struggling and the breast milk will not come out. If you put the baby, it's supposed to be on that dark portions areola.
Yes.
So if the baby is large, you see a good attachment. The baby is out, and then has a large the chunk of the breast in the mouth. The breast milk. Even you yourself as a mother, you'll be hearing the sound.
You hear it.
And then when you start, you see the child, raising the leg, raising the hands, and thump to the mother,
and even smiling.
Because he's just having a good time,
having so much fun. Thank you. Thank you so much. So we've had different cases of women always struggling to lactate. It's such a big time problem for some women. So most times they ask, what can I use to lactate, and my breast is not coming out, I'm not able to feed my child. It can be mentally draining for some women. They want to breastfeed that child, but the breast milk is not coming out. So what do you think they can do to improve their milk supply?
So maybe just to start by saying that for the milk supply, it has something to do with the mother's maybe food. It has to do with the state of mind of the mother. The breast milk that the child is taking is not the food that the woman ate yesterday or 2 days ago, that produce the milk. Actually, breast milk starts, the planning when the woman get to puberty. You see, she's changing, she's getting ready, to produce milk at any time is going to be required.
Okay, so it's not when they're pregnant.
It's not that time that the child. It's not that time. The body has mechanism which it take away fat and all that energy from the body to make milk. You understand? What the woman needs is to have that suckling reflex. If a message is sent to the brain, the milk is needed, it will be produced. There's some women, for example, who had stopped breastfeeding for a long time. Maybe they can also relactate. There's some grandmothers who had stopped breastfeeding for many years.
They're called wet nurses.
Yes, it's true. And then sometimes they bring the baby to them. And the baby to them, maybe the mother is not around, and the mother say, they might just be playing around. With it. And before the breast start coming out. You will wonder, where is the breast coming from?
So are you saying that the baby's mouth triggers the breast milk to come out?
The suckling reflex.
And then the state of mind.
Yes, helps. So if the woman, but of course, for our own health, to be in a very right frame of mind, also the woman needs to eat very well, right? Because there have been even findings that shows that women who are even like malnourished can still produce adequate milk for the child, right? But that woman's health also needs to be attended to. And that's why we can't just show them and say, well, just go and breastfeed, no matter what happened to you. Breastfeeding is an experience, and it's supposed to be something you enjoy.
Yes.
Right? So for you, when you are relaxed, you have what you need, you have the support system, you have, adequate water. Of course, breastfeeding women are also expected to or recommended that they take like 2 extra meals per day than usual, because it's a lot of energy that is taken out from them. So they also need to replenish for their own health and all that. So that's part of the thing we look at. I had women say, I can't breastfeed, I can't have enough breast milk and all that. Those are some of the things that require counseling and support. Most of the time, women don't have access to quality counseling, like a one-on-one. Sometimes maybe experienced mothers, experienced health workers that can sit them down and explain, this is how this thing works, and just relax. Don't be anxious. You have it. And then after some time you see the breast milk coming.
Okay, so you're saying that our mothers they will tell us to take more pap, because when the men just have a baby, they'll tell you to take pap, tea, and the likes to help with the
just fluid,
the breast,
to hydrate
the mother, because
yes,
that's a lot of breast.
It helps. Yeah, it helps to replenish.
Yeah, because sorry,
go on,
that the breast milk is 60% water.
Yes,
so you need to keep yourself hydrated, because that's a lot of milk. And remember when I used to express, after feeding, and then it fills up really fast. I express boss, I'm still like, well, where is this coming from, right? So, and then I feel weak sometimes. But when I take the pap and I drink fluid and I eat, there's some sort of replenishment that goes in. So, yeah.
That's amazing. Yeah. All right, then. Thank you so much. So we know that breastfeeding is very, very important for babies. What are the benefits for mothers, Ms. Chioma?
The benefits they're uncountable. I mentioned earlier that it's a time to bond. It's a time to love your child. The bond between the mother and child it's out of this world. Is unbelievable. It's also an opportunity for you to build your child's immune system, right? Because all the antibodies they need to grow to fight some germs, all diseases,
illnesses.
Yeah, they have them right at that during breastfeeding. Lots of them, Mr.
Yeah.
Can you help me?
I can just add again. Okay.
No.
I can add again that you started with laying some of the benefits out, which is so for both the mother, the child, the household, the society, they benefit from breastfeeding.
Yeah.
Apart from the fact that it helps in bonding, and then the immunity, it keep the child from falling sick. It reduce footprint in the hospital.
Economical.
That's very important.
Yeah, especially that the first 6 months you're not buying baby food. Baby food
is just really expensive now.
Exactly.
I'm telling you.
Think about it. How many things of infant formula will a child need for the first 6 months?
Exactly.
50, and then maybe up to the rate of 10,000.
Are you saying 10,000?
No, it's not 10,000.
Over 50K, 50K, 70K.
Yes.
Yeah.
Yes,
So
right now.
imagine how much money is. In fact,
you're saving a lot
when
of money.
Promote and support breastfeeding, we talk about for every $1 we invest, we have $35 in return on investment. And then apart from that, for the child, it's also help the child to develop brain. It help them in their brain development. It helps in the the jaws, the dentitions.
Yeah.
Breastfeeding has been very, very good, even for some of the child
eyesight.
Yes,
I remember. Sorry, there's this thing I remember. There was Apollo. Is it Apollo?
Okay.
There was one mother that the baby had Apollo. I remember them telling her to put the breast milk, to drop the breast milk. I don't know. There's no science. I don't know the science behind it.
Yes,
but she did, and it worked.
Yes,
it worked.
Yes.
So the antibodies that we're talking about,
that then the breast milk.
It's in the breast.
And one other thing that I think is very important for the woman is the fact that it helps to reduce the risk of ovarian cancer and breast cancer.
Yes.
Breast milk has
been, absolutely.
And then in terms of environment, all those things of milk that you throw away, even the production of those, infant formula, they come at the cost of the environment.
Yes.
They don't have a lot of carbon footprints.
Yeah.
So breast milk also helps, in
curbing all those
things. Some of them, because
it's quick, it's hygienic. You just come, take a clean swab, clean and feed your child. You don't have to wash bottles. You don't have to sterilize anything. This is the first 6 months, and so all of those stress,
and you're saving costs.
Yes, saving costs, and all of those stress that you go through by when you want to bottle feed your baby, you don't go through all of those stress.
Okay, thank you so much. So I'd like to ask Mrs. Chioma, do you have any worst experience as regards breastfeeding?
No, I never. The only the only bad experience I had was when they stopped. They didn't want to take breast milk again. It was so bad, and I was still lactating very well. So the breast would be so hard. I found myself expressing and sometimes
So it was a struggle
disposing
to win.
of the
No,
it was so
I can imagine.
My son stopped breastfeeding at 9 months, and then my daughter earlier, but she just wanted food. I don't know I don't know. I can't even explain. You know, when I will be feeding her brother, she would just be there doing. I said, no, it's not yet time. Just take breast milk, and I don't know why she stopped earlier. But her brother was I breastfed him till 9 months, and when he stopped, it was really, really painful because I was still lactating, like I said earlier. But I found a way. You know, I had to stop expressing, because the more you express, the brain says, "Oh, I need to replace." You know, I need to replace this thing. So I had to stop expressing. I just let it drip. You know, it was painful. That's the only painful thing.
The encouragement.
And it's so hard. Very hard and painful.
We need to talk more about breastfeeding pain. We delve so much more on childbirth pain, the pain of childbirth, but nobody talks so much about breastfeeding pain. It's a lot of pain.
It's a lot of pain, and it has a lot to do with the mental state of the mother.
Yes.
But it's equally rewarding.
It's best.
I mean,
motherhood is rewarding, isn't it?
It is. It's rewarding. At the end of the day, the child is active, is smart, is strong, is resistant to disease and infection. Is brilliant.
Yeah, is the word.
Brilliant. You know, and then you see them compared to other children. Then you're like, that's my child.
Yeah,
you know.
Surprisingly, I breastfed all my children. I did 6 months exclusive.
All
three of them.
Bravo.
Yes. Thank you so much. It has been a really interesting conversation. And do you have any final notes to mothers out there about breastfeeding, Mrs. Chioma?
If you've been listening, you know that there's several benefits to breastfeeding, and it would encourage you to breastfeed your child, at least exclusively for the first 6 months. The benefits are numerous. You want to gather all those benefits and enjoy that time with your child, bond with your child, save costs, be healthy, stay healthy, empower your child food wise and so many things, right? I don't know if Mr. Ebenezer has, because during the course of the show, I'm sure we've listed a number of benefits for breastfeeding that mothers can learn from.
So I think it's just to encourage mothers, and USAID, you can see we have an ambassador now. I'm talking about breastfeeding. Our dear Chioma is a very important thing to us, because we look at that first 1,000 days, as I mentioned, from the day the child is conceived on the 2 years birthday. It's most critical time. Right, if you count the number of days, there are 1,000 altogether. 9 months pregnancy, 6 months of exclusive breastfeeding, and then from 6 months up to 2 years, if you put all the days together, there are 1,000. So it's the window period with which you need to intervene, right? And the critical intervention within that time is what we talk about, the early initiation of breastfeeding. Within 1 hour, exclusive breastfeeding for the first 6 months, continue breastfeeding, plus, as I said, appropriate food that is appropriate for age for that child. That is the best gift you can give a child. It gives them a right start in life, and they also have more resistance, or they are a lower risk of non-communicable disease later in years.
Yes.
Type 2 diabetes, obesity and all that, when a child is, breastfed exclusively. So the benefit is enormous. So it's far more outweigh the challenge you face. We cannot deny the fact that it's challenging.
Yes,
but then it's also a very rewarding experience, and you can always
it's a lot of sacrifice.
Yes, it's a sacrifice that you need to make as part of it. So we wish all the mothers out there, World Breastfeeding Week.
Happy World Breastfeeding Week.
Happy World Breastfeeding Week. And then to also congratulate Nigeria for setting a new world record of most mothers
that
breastfeeding is simultaneously.
Yeah.